All right, this is Panda Admissions and Medical Billing Training. My name is Katie Bjornson. I am the project manager overseeing the Panda project for Willits Technology. I work very closely with Amber Taranis, who is the SQL project manager working on Panda, and also Marianne Birmingham, who is definitely the meaningful use, policy, outcomes, regulations guru. Very happy to have her on the team because there's some of the stuff that just gets so complex, and she's definitely a great resource. So if you guys have any questions about anything, you can really reach out to any of the three of us. We work so closely on this project and communicate constantly, so any of the three of us will be able to help you with any question that may arise. In your training manual, I provided some detailed information about Panda, what it means, why we're implementing it. I'm not going to cover that in training. I just wanted to provide that for reference, but if you have any questions, please let me know. So this training was initially scheduled for 2 hours, but it hasn't been taking that long. It's really been taking close to an hour and a half, an hour and 20 minutes. But it really is just dependent on how many questions we have at the end of the training and so on and so forth. So I will work through the items that we need to cover, and we'll cover any questions that we have towards the end. So Panda MU went live at Woodward Academy on May 1st. It just rolled out at SQL Care of Arizona on the 1st of June, and then also is rolling out at SQL Alliance on the 15th of June. And then after that is Bernalillo coming out on July 1st. So our schedule for implementation has been pretty tight, but this rollout is really focused on the SQL sites whose medical departments are going to be using Panda to attest to meaningful use in 2016. So basically what that means is these sites have a doctor that has committed to attesting to meaningful use using the Panda system. So basically, I don't want to get into a bunch of detail about meaningful use because it is so complex and you could literally talk about it for a week straight and still not understand it. So basically, meaningful use is a Center for Medicaid and Medicare incentive program, and it's really encouraging providers to use a certified health technology to improve patient care. That's the ultimate goal. Meaningful use requires us to submit information to CMS on specific objectives that they have chosen. So there is a lot at stake with this project. I know some people are thinking, why are we implementing this new system? Why are we moving forward with this project? There's just a lot at stake. There is probably over $1.5 million for SQL as an organization that's at stake. State and Medicaid contracts are starting to require providers and programs to use a certified health technology. So there's just a lot involved and a lot of purpose behind this project. It's definitely way beyond Panda and Willits and SQL. The goal is definitely to get the medical department using Panda for 100% of the documentation, and really only the medical and admissions teams will go live with Panda MU. And the admissions team is really playing a support role with this process. We need you guys to enter in the information into the system so that the medical teams can be successful for meaningful use. So I think it's really going to be helpful, especially at those sites that aren't using another system, for you guys to start getting familiar with the technology, because after we're done with Panda MU, we're going to roll out Fat Panda. We named it Fat Panda because we literally were calling it 10 different things: Full Panda, All of Panda, Complete Panda. Fat Panda basically means the entire Panda system. It is going to include case management, clinical, QA, the direct care staff will be documenting in it. It really is going to include every department at our sites within the SQL organization. So we are planning on rolling that out starting in 2017. And so we really had to focus on rolling Panda out in these two separate phases so that we could be successful with meaningful use in 2016. Panda had to go through a very stringent certification process. It took us probably close to 11 months, 10 months, to complete all the requirements for the certification. We basically had to jump through about 42 hoops, things that Panda had to do and had to be tested on. And that process was very involved, very time-consuming, so we needed to make sure we got certified first. That was our #1 priority, and now our second priority is attesting to meaningful use in 2016. There is a section in your manual about attendance and quiz. Sounds like you guys were going to have that covered. Make sure you are signing a Panda training roster. Those are managed by the super users at your site. That's the only way really to get credit for this training, so it's definitely important to get your name on one of those. And the second piece is the quiz. So I recommend that you do the quiz immediately after the training because all the information is going to be fresh in your mind. And I can tell you this quiz is really straightforward. I honestly think that people could probably take the quiz without attending the training, but that might be reaching a little bit. It's usually about 5 to 6 multiple choice questions. It's very basic. If you pay attention at all, you won't have any problems with the training at all, or excuse me, the quiz at all. Next section in your manual, kind of some logistics and policy type of items. HIPAA and EHR data security. I know everybody knows what HIPAA is. It's talked about so frequently in so many different ways. The one thing we've really been focused on with Panda is the minimum necessary standard. And that is a key protection component of the HIPAA privacy rule. And it basically means that you should never access information in the EMR that you don't need to do your job. So if you are only assigned to patient A, B, and C, then you should only access patient A, B, and C when you log into the system. As admissions, you guys have to access every patient chart to get the intake process entered in. So that is completely understandable, but it's just making sure that you're not accessing areas of the system that are not required to do your job function. There are some safeguards in the system. I think the one that's most important to note is the Panda audit log. This is required for EMR certification, and it basically tracks every movement all of us makes in the system. If I log in and I go to John Doe's medication list, it's going to note in the audit log that I was in John Doe's medication list and the time I was there and who I am and so on and so forth. So really important to note that. That is really a good security function within Panda. There's some information in your manual about possible penalties with HIPAA. I just think the most important, the bottom line, behavioral health information and psychiatric information is highly regulated and protected, as you guys all know. So we just want to make sure we're doing everything possible to protect our patients' health information. All right, let's talk about some goals of Panda admissions training. I want to give you an overview of how to navigate Panda. I want you guys to gain some understanding of the Panda patient portal and how to set up portal users. That is one area that the admissions team can really help the medical teams be successful with meaningful use. We're going to talk about how to complete an intake, how to roll a referral into an admission. We're also going to talk about medical insurance, how to enter medical insurance into the system. You will have the ability to edit, view, and enter client demographic information, and then also talk briefly about client contacts. So when you first log into the system, you're going to log in using your Panda email and your SQL email and password. Good news, you do not have to type out SQLYouthAndFamilyServices.com, thankfully, because that is a long email address. So first name dot last name will do it. The system is going to open up. It's really straightforward. I'm really hoping as I go through this training, you guys are going to think, man, this is a pretty easy system to navigate. It's really easy to find what I need to find. One thing, when you first log into the system, I really need everybody to go to their name in the upper right-hand corner and click Profile Settings. Don't feel like you have to do this in the sandbox, but it's really important in the live environment. Once you select your profile settings, this time zone field is super critical. The default is Eastern, so if you're at Bernalillo, you definitely want to make sure you're coming in here and changing this. This timestamps your documentation in the system, and you want to make sure your timestamp is correct. So please come in here, change your time zone, make sure it's accurate. Another item in here, some of you guys are a lot more colorful than I am. I kind of have gotten stuck with the black and white Panda theme, and I have to tell you I really like black and white, but for those of you that like pink or orange or red, you can change the theme of the system just by selecting one of the items from this drop down. I may have to delve into the Christmas item when we get close to Christmas, since I do really love that holiday. But the theme can be changed there. Save your information and you'll be good to go. So you really only need to do that time zone thing one time when you first log into the system. So with regards to navigating the Panda system, you guys can see that all the items are going to be visible from the left-hand side. The items that you guys see, I am a system administrator, so there's going to be items on the screen that you'll see that aren't applicable to admissions, and you will not have access to those items. What you have access to is very specific to your job role. So, but if you're running into a situation where you need to access something and you don't have access, please reach out to us. We can always make adjustments to the Panda security or change something specifically for you if your role. I know there's a lot of SQL staff that wear many hats, so we need to accommodate that. So please be aware of that if that situation arises for you. I do have some screenshots of all of the icons that are in the system that you're going to run into. I do want to cover the first three because I feel like they're the most important. The green plus sign is used throughout the system to add documentation. There is a blue eye icon that is used to view additional information about documentation already in the system. And then you'll also see the edit documentation icon, which is orange pen and paper. And you're going to see those throughout the system. Everything is really consistent, and hopefully that makes it a lot easier to use. So selecting a client. When you select a client, you can easily do that from here. Just click on that No Client Selected. I can search for my client here. Also, in your manual, there's a screenshot. I'm not sure if it's going to trigger me to do it right now because I've been in the system a lot today. Let me go here. Oh, it did. So the set active client, if I try to go to an area of the system and I don't have a client selected, it's going to prompt me to select a client. So it's the exact same process. You just search for the client that you want, and you can select them from that drop down. The client header. I don't know if this is going to be as applicable for admissions, but it sure might be. Throughout the system, you're going to see this little blue down arrow, and this is the client header function here. If I click on that down arrow, it's going to show me basically a snapshot of this client's medical status. I'm going to see the picture of the client, which was the #1 requested reason that we created this client header. We know that you guys work with lots of clients. It's hard to keep track of who's who. I personally am terrible with names, so I would be very grateful to have the photo of my patient in as many places as possible. From here, you can also see the birth date, allergies, the medical insurance that's on file for this patient, and then medical alerts that have been added for this patient. So this is really critical information that's been added by the medical teams that anyone should know about this patient that's in your care. Required fields through the system are always marked with a red asterisk, so you will not be able to save documentation and move forward unless you complete those fields. All right, I added one little section in your training manual fairly recently about Panda documentation. We have run into this in a few of the sites that have already gone live. Let me just say one of the sites has already gone live with regards to making sure we are documenting client information in a timely manner. Obviously with intake, you guys do the intake as soon as you get it or whenever it's most convenient or whenever you can. But I think this is really important for any sort of medical documentation or any other documentation in the system. You cannot backdate information in an EMR. It's impossible. Everything is tracked through that audit log, and I think sites that have been on paper for a significant period of time, it's going to be a big adjustment. Even with some of the medical staff, you don't always get to document things immediately, and you definitely want to make sure that you are just doing your best to document in a timely fashion, since information cannot be backdated in Panda. All right, let's talk about the Panda admin menu. Main focus here is the patient portal and setting up portal users. So I'm going to tell you guys, I know this admin menu looks intense, but all you guys are going to see is portal users. So you'll go admin, and portal users should be on the top of the list. It should really be the only item in that menu for the admissions security. So patient portal. This is a meaningful use objective, and this meaningful use objective requires SQL to give patient portal access to more than 50% of patients. This really is an important area. We need admissions help to be successful with meaningful use. So let's talk about a few things. What is the patient portal? Patient portal is a website. It's basically connected to Panda, and it is a place where patients can go and they can view, download, or transmit their health information. It contains their current medication list. It contains their allergies. It'll list out the diagnosis that they have in the system. It doesn't contain detailed information like psychiatric notes or nursing notes. It's basically a snapshot, is what I like to call it, of the patient's chart, the most critical information. It also provides a platform for secure communication, so a portal user can communicate to their doctor through the patient portal. And this was all required for certification. It's all required for meaningful use, and that's why we have it in place. So how do people get access to the patient portal? We are asking admissions to own this piece of meaningful use, since there's really not very many pieces that admissions can be involved in. They really all fall in the medical team's lap. So with regards to the patient portal, you have to be set up as a portal user. The only thing that is needed is an email address, which I do feel in today's day and age, most people in the world have an email address. So you might be thinking, how are we going to set up our clients or patients as portal users because our patients don't have access to the internet, they don't have access to email. So we have a workaround for that. For the residential sites, when it is most appropriate, you guys can set up the legal guardian or you can set up the referring worker. Basically, anybody who has consent to view a client's medical information can be set up as a portal user. And I know for the residential sites, they're really leaning towards the legal guardian first, and if not the legal guardian, then the referring worker. So the mom could log in and see what's my kid currently on medication-wise, or has his diagnosis changed. We're hoping that over time this is going to maybe reduce the need for phone calls and constant communication. At some sites it may not lead in that direction, but at some sites I feel like it might. I think it's going to be a great resource for parents and a great resource for workers. So those are the people that can be set up as a portal user: the patient, a legal guardian, or the referring worker. So next we've talked about what is the portal, how do they get access to it, when we need to get access to the portal. This is an important item. So for new clients, our goal is to have this as part of the intake process. That we'll just come in, we'll set up the portal user as part of our intake, and it'll be done and completed and good to go, and the medical teams don't have to worry about it at all. For current clients, we really want portal access set up prior to the clients seeing the docs in Panda, using the documentation in Panda. So we've been recommending that this be done as part of the pre-go live preparation, or when the client first arrives for their first appointment with the SQL doctor in Panda. So I know this sounds maybe getting a little complex, but bottom line, if we can set them up at intake when they're new patients, and if we can enter the current patients up, set them up as portal users prior to go live, I think we'll have all of our bases covered and we'll be able to meet this 50% expectation. One thing to note for meaningful use, if we do not grant portal access to a client within 72 hours of the first Panda encounter, the numbers count against our MU reporting, which we definitely don't want. So that's why we're really focused on trying to get it done prior to the docs seeing the patient and using Panda for that documentation. One other really important thing to note, and I highlighted this in your manual, proxy users, which would be the legal guardian or the referring worker, there's no exception to this. If a client has a proxy user set up in Panda, when the client discharges, it has to be inactivated. It doesn't matter what the situation is, what the status is, any of those things, it is required to be that way. We're really just trying to protect that client long term, because after they are out of our care, we really don't want to be sharing their medical information with anybody. It's not our place to do that. So I'm going to show you how to do that. Setting up a portal user, very easy, very straightforward. So you'll come to admin, you'll have portal users here at the top. You'll click on the green plus sign. Like I said, all you need is an email address. I'm just going to do, let's do caseworker. It's not going to like that. This is where you would set the worker or the user to active. So if it's set to active, they have access to the patient portal. If it's not set to active, they will be denied access to the patient portal. So I know Mary Ann's recommendation is that if you have any sort of discharge checklist at your site, you should add this step. Double check, does this person have a proxy user for the portal? All you would need to come in here and do is just unselect that box and save. And now they're deactivated, and we've covered our basis for the safety of the patient's health information. So for this, when I'm setting them up new though, I want to make sure it's active. I'll select my time zone. And then this clients field, this is who this patient, this is the information the portal user can see. So let's say that this caseworker is Panda Bear's caseworker. So now when this caseworker logs in, they're going to be able to see medical information for Panda Bear. If this caseworker has multiple patients at your site, which I know sometimes does happen, you can add multiple clients, and those clients will all be available in their little drop down here in that client field. I'm going to tell you that in the sandbox, the adding the portal user and sending secure messages does not work. If I hit save right now, I'm going to get the Panda error, which is a big, I'll show it to you, big panda cartoon, and it's going to say, oh, it's going to process. Yep, there it is. Troubles, there's our Panda error. The reason it's doing that is because this is a testing environment and it's not connected to anything. I'm using fake email addresses anyways, so it wouldn't be helpful in any way to be sending any sort of messages. So one thing to note, when I hit save, what happens is the system will send a message to this email address that we've noted, and it'll say, caseworker, welcome to the Sequel Youth and Family Services patient portal. Please follow this link to log into the portal and to set up your password. So they'll have the link to the portal, they can go to the portal, set up their password, and then they can access information on that client that we've selected for them to have information access to. All right, that's all I had to cover under admin. Let's go to admissions. So with admissions, we're going to talk about the intake process, which is probably the most important. We're going to talk about rolling a referral from the Panda pipeline. I know you guys have been using the Panda pipeline. We're going to also talk about completing and entering medical insurance information. So I'm going to start with intake. If I click on that intake, it's going to bring me to this screen. If I want to search for a referral that's in the pipeline, I would just search for my referral, I would select them, and then I would hit choose. And that's going to allow me to roll this referral into an intake. In your manual, it notes there's 5 fields that are going to roll over. It's the first name, last name, date of birth, state, and sex or gender of the patient. Please note that in the pipeline, or when you're using the referral system, you need to make sure that that patient has been accepted to your program. If they haven't been accepted as a referral, they will not appear in this drop-down. So if you're looking for somebody and you're thinking, man, I know they're in the pipeline, I know they're in the referral section, if they're not set to accepted, they will not appear here. So please be aware of that. I'm going to go ahead and start a referral from, or a intake from scratch. So we'll just do Ann Jones. I'll enter in first name, last name, date of birth, and then location. So you guys should only see your location in that drop-down. One thing to note, the reason that we created it this way and had this information be entered in this screen versus the main intake screen is when I hit create new client, the system searches to make sure that there's no duplicate patients. We had a few issues with that when we first started because we did not have this process we were trying to search, and it searches based on the last name and it searches based on the date of birth. So if either of those items match with the patient in the system, you'll get a little pop-up and it'll say, hey, there's already a patient in the system with this information. It'll allow you to select that patient, or it will allow you to create a new patient, because I know there may be situations where we have people with the same name and date of birth. It's probably pretty rare, but I'm sure it could happen. So this is the client intake form. The first name and last name has pulled through. I think the best way to navigate this is to just tab through the fields. I think that's the fastest. Your guys' dorms have all been added here. If I go to admission, I just need to click in that field. It's going to select the time right here, right now. So today's date, and it's 1:36. If I need to change this, I can change it using the calendar. And if I need to change the time, I just click on that little clock, and I can change the time for that intake. Social Security number is not required, but I know a lot of programs require it, so if you guys want to enter that, feel free to do that. I'm going to focus on the required fields. It's really up to each site to determine if they want to add additional information. Some sites have decided they want additional info, and some sites have decided, you know what, we don't need anything additional. Let's just go for the required fields only at this time. So again, I think if you could tab through, it helps. And the way it works is it goes down this first column and then it pops to the second column. It goes down the second column and then it'll go to the third column. So please just be aware of that as you're going through. Ethnicity and race is required. We've had a few requests for people to add different items from this ethnicity list or the race list, and I'm sorry to tell you these are set forth by the federal government and we have no control over them. some of them are really limiting. So I'm sure we're not covering every single base we need to cover, but it is required that we have these options per our certification process. So I've completed all the required fields. You'll notice that the preferred language is required, but it always will default to English. So if you need to change that, feel free to do that. Oh, something's wrong. It's alerting me to something. Oh, I need to select my program. Let's go with PRTF. And I'll hit save. All right, so once you save the intake, it's immediately going to take you to the client demographics screen. So say you completed the intake and you look back and you're like, oh my gosh, I got the wrong phone number listed for this patient, or I have the wrong address. I put in wrong digit. To change any information on the intake form, you're going to do it from demographics. Because if I go back to admissions and I go to intake, it's going to start a whole new intake process for another client. It's not going to allow me to change anything from this last client. So everything can be changed from client demographics. If I need to add a middle name to use my stepdaughter's name, I can easily do that by selecting the field. If you want to save something you've changed, hit that checkbox. If you don't want to save it, you can just cancel out and get out of that field by clicking on that X. But anything on this screen can be easily modified. Say you need to change this date of admission, it wasn't 100% accurate. You can easily change that using these fields. All right, let's talk about medical insurance. So in some ways, you guys are at an advantage. I think I set this up in the sandbox. Let's see, I did. Because you guys have designated that Bernalillo, this is based on my understanding and communications with Shannon, Bernalillo is always the guarantor for outstanding medical billing. Let me take one step back. The medical insurance screen, really, we did not plan on embarking on medical insurance or billing or anything along those lines anywhere near the Panda MU rollout. But because we chose to work with a third-party lab vendor that is allowing us to send labs and receive results electronically, we had to create this medical insurance screen. So basically what happens is if we create a lab order in Panda, the medical insurance information that we enter into this section is sent to the lab. So then the lab knows after they bill the insurance, who does the outstanding information go to, outstanding bill go to. For you guys, it's always going to go to Bernalillo. So the good thing is we've set up something in the system, so this is always going to default for every single patient that you have. So there's really even no need to even open up that little gear icon. This will always default every single patient to Bernalillo Academy. So that is great news. One last step for you guys to worry about. So you want to make sure the guarantor is in there. Once it's in there, you hit the green plus sign. And then from here, you can either copy from the guarantor, which wouldn't necessarily be appropriate for Bernalillo, but you also can copy from the client. We just recently added this button, which I think is going to save people a lot of time. So this is going to pull all of the demographic information from my client into this insurance holder information section. All the required fields are completed. I need to fill out some other fields. I sure can, but they are not required. This bottom section is the insurance information section. So it sounds like you guys only work with Medicaid patients. So what I would do, I would search for Medicaid, and then I would scroll through and I would find my little New Mexico. Where are you at here? There you are. So now I've selected my Medicaid New Mexico. I'll enter my Medicaid ID here. Group number doesn't sound like that's very applicable when it comes to Medicaid. If there is an insurance you run across that needs a group number, you can enter it there. The relationship for this situation would be self, and then we would want to note this as the primary insurance. If there's any medical insurance notes that you want to document, you can do that here. This was kind of added for the outpatient sites. They wanted to be able to track copay and those types of things using this notes section. So really straightforward. Hopefully it doesn't take a whole lot of time since we've added that copy from client functionality and the ability to have the guarantor default for the residential site, so it doesn't even need to be added. All right, let's talk about discharge. Oops, excuse me. I was like, wait a minute, the menu is not there. There it is, discharge. Okay, so this kind of is a new section that was added. Discharge transition of care. This is another meaningful use objective. And I think it's important for you guys to talk to the medical teams and figure out who's really going to own this. Based on my understanding of a lot of the residential sites, it does seem like the admissions team manages the intake and the discharge process. So if that's the case, you definitely want to be aware of this meaningful use objective. So this meaningful use measure basically states that when a provider transitions or refers their patient to another setting of care or to another provider, that we need to use Panda to create a summary of care record and transmit that record 10% of the time. I know it's a mouthful. I feel like this MU objective is probably one of the most complicated, even though I probably can work on simplifying it. So basically the summary of care record is a little mini patient chart. It's going to contain critical information from the patient chart from Panda, and it basically allows the docs to send an electronic chart to the receiving doctor. And this can be done during a referral process, but it can also be done through the discharge process. And I think with you guys being a PRTF, this may be something that is done even more significantly or more commonly than some of the other sites, because I'm assuming that you guys know the provider and the doc that you guys are transitioning this patient to, since your patients require additional medical care. So basically, here's how this process works. Date of discharge, let's say this patient is going to discharge today. Discharging provider, this will be a list of your 3 docs. Discharge type. So if you do not know the provider that this patient is going to see after they leave your care, this would just be a discharge. And when you hit discharge, it's going to say done, and you're good to go. Note this question has been added here. Has portal proxy access been inactivated? So it is going to ask you, and it's kind of a reminder, hey, if there's a proxy user for the patient portal, you need to make sure you're going in and checking that box to make sure they're not active. But if you do a discharge, it'll just discharge the patient. If you do a transition of care, it's going to give you a list of items, and note that none of these are required. I think it's important to at least put in the provider's name and maybe the provider's phone number. And I think this is going to require some coordination between the case management and clinical and medical and admissions team, so that everybody's kind of on the same page as to who is managing this, where is this patient going, so that we're being proactive with this process for the summary of care record. So it's going to ask me for this information. I've done my proxy access. I'm going to hit discharge. It's going to ask me again, are you sure you want to discharge? Yes, I want to discharge. All right, so a couple things. This client has been successfully discharged. You'll notice that their name now appears in red. In the system, if you see a client with their name in red like this, it means they're discharged. They're not active clients. Let's talk about these other sections that are in here. If I want to print a summary of care record and send it with the patient because that provider that they're going to can't receive it electronically for some reason, you can easily print this record. So I would just go, Dr. Jones, I would download HTML. This is the one, it will always be defaulted to this, and it will hit generate, and then that document will download in that left-hand corner. So this is what a summary of care record looks like. It is very straightforward. It's going to give the patient information, and I haven't entered in any client information or any medical information for this patient since I just did their intake. So we're required to show all of these items: advanced directives, allergies, any family medical history, cognitive status, immunizations, medications. The list goes on and on. And with this encounters, it'll just list the number of encounters that the patient had with the provider. So I know there's a lot of information here. If you want, you can print this and send it with the patient. That doesn't help us with meaningful use though. The part that helps us with meaningful use is this section here, transmit transition of care. So if I know the provider that this patient is going to, what I would do if I was in admissions or if I was in the medical department, or if you know that we transition patients to specific providers frequently, or you have a program that you work with, maybe that's a step-down type of program, I would contact that program and say, hey, are you guys using a certified EMR? And if they are using a certified EMR, they are required to be able to accept summary of care records. It's a requirement for certification. So basically what happens, I would select my provider, I'll say with Dr. White, I would put in this direct address, which direct address would come from that receiving provider. So if I transition clients constantly to, let's say Sunshine Academy, it's down the road, it's a step-down program, all I would need to do is call Sunshine Academy and say, hey, do you guys have a certified health record? You do? Awesome. Can you please give me the direct messaging address for your provider? And the direct messaging address is really similar to an email address. It's almost exactly the same. So you would put in that direct messaging address here, and then you would hit send, and it will immediately send that summary of care record for your patient to that receiving provider, which is basically that snapshot of the patient's health record. I know there may be questions on that. Hopefully we can talk about those at the end. So please just be aware of that. This is another area that we can really help the medical teams with regards to meaningful use. One thing to note, when you discharge a client, you're not going to find them in this list up here anymore when I go to search for them. To see discharge clients, under the client menu, there is a discharge clients list here. These are all clients that have been discharged. If I want to see their patient chart and launch their patient chart, I just click on this checkbox, and then I can navigate the system and I can see all the information for this patient. Again, you'll note that this is in red at the top, and that just means that this patient has been discharged from our care. All right, I got a few more things to go and then I'm all done. Client menu, we already talked about demographics. Just want you guys to know where it lives. It appears here. We talked about editing. Very easy to edit documentation in here. Clicking a field and changing the documentation, whatever you need to edit. Let me get back to a live patient here so I don't cause myself some confusion. The other item in here is the contact section. So we are really asking the admissions team at the point of intake or prior to go live to enter in 2 client contacts, the legal guardian and the emergency contact. I did tell the medical staff that if there is other contacts that they really need in the system, that they should be communicating that to you. I feel like the legal guardian and emergency are the most critical, but I know every site has a different workflow and different requirements, so please be aware of that. So to come in here, I go to Client, I go to Contacts. This is my list of contacts. This screen I really want to change prior to going live with Fat Panda. We kind of put this together because it was a certification requirement, but my goal is definitely to get the main phone number visible from this screen because I feel like this information is really not that helpful. If you guys need to view information on a contact that's already been entered, I can easily do that by clicking on the edit icon, and then I can see their home phone number or I could see their address. There is a ton of fields in here, different communication preferences, a lot more fields than you probably would ever need, but a lot of these were required for certification and a lot of them have been requested by some of the SQL sites. So to add a new client contact, I just hit on that green plus sign. There's 2 ways to do this. So you can search for a contact, and I think the searching for a contact is going to become helpful when you have workers that you work with frequently, that place clients with you guys frequently. Say I had a social worker that had 3 different clients at some point in time. I could search for that client contact and add that client contact to my patient's chart without having to enter all that information over and over and over. It will pull all the information in and will allow you to connect that contact that's in the system with this patient. For this, I'm just going to create a new contact. There are only 2 fields that are required in here. I don't think we can make it much easier. Let's say we're going to go with Mother Bear. So first name and last name. That's required. Obviously, we definitely want to enter in additional information, but everybody has such different requirements. We thought it was just best to leave this open-ended. So phone number, pretty obvious. Address, you would put those in here. Please note, with the contact role, if I'm doing an emergency contact, I want to select it under contact role. I've requested that we make a little change in here because the contact type also has emergency contact, but this will not pull it onto the client's face sheet. So I'm I may just have them remove this so that it's only available under contact role, but if you do it under contact role, it will appear on the patient's medical face sheet, which is important if you guys are going to use that for any sort of appointments or visits. Contact type, lots of items in there. Right now it's defaulting to mother, which in this situation is appropriate. If you guys have no contact situations, you can add that here. I know that this contact section is probably going to change and evolve as we move forward, because I do understand it's a really important area of the system, especially for residential sites. All right, secure messaging. You know, to be honest with you, I have this in the training guide, but we recently made a decision that secure messaging is going to belong to the medical teams only. Just because there's a meaningful use component wrapped up into secure messaging, and it is really important that secure messages come from a medical staff member or a medical administrator. So I'm actually going to skip over this section in your training manual since we recently, that change literally happened within the last 24 hours. I apologize. All right, I'm at the end of the manual. I do want to talk about a few little logistical things. Panda Go Live support. So what do you do if you have questions about Panda? We have super users at each site. I definitely want you guys reaching out to the super users, asking super users if they have answers to any questions you may have. If they do not have the answers, we have created an email that links to our support ticket system, and it is panda@teamwillets.com. This creates a support ticket, and someone from SQL or Willets will follow up with you as soon as we can with regards to your ticket or your question. If it is like a training-based question, it'll probably be myself or Amber Taranis reaching out to you. If it is a more technical problem, like you can't log in or maybe you got an error of some kind, then the Willets IT team will be the ones following up with you since they are definitely the experts on that. Please make sure that your contact information is included. I think that's pretty straightforward since most people do have a signature on their email. And tickets are really going to be based on priority. If you have a high priority issue, and I've told most of the sites that the first thing that comes to mind is something that has to do with patient safety. So if it is not a patient safety issue, please don't note it as urgent or high priority. I do understand if you can't get into the system and you're an admissions member and you have to get a client in, that's pretty urgent, and I can respect that for sure. So if you have something that's urgent or high priority, please put it in the email line when you send the message, because that will add it to the title of that support ticket, which will be super helpful for us because we'll be able to tell which issues we need to focus on first and which ones are really the most important. We have created a Panda suggestion box. It can be found on the SQL staff portal. So if you log into the SQL staff portal, you'll see the Panda logo. If you click on that logo, it will take you to a section that has the Panda suggestion box. There's a bunch of other information in there about Panda, but that suggestion box, we really are encouraging people, if you guys have ideas on how to improve the system, put them in that suggestion box. Basically, the SQL team is reviewing those, and I think over the time of this project, we are just going to work to improve the system more and more and more. So we really appreciate any input you guys have. We've already incorporated so much feedback into the system. I mean, the system is, like I say, 10 times better today than it was when we went live on 5.1. So we are constantly changing and improving the system, and we appreciate your help with that process. You guys know way better than we do since you guys use it every day and do the day-to-day stuff. So we appreciate any help you guys can provide. Panda Sandbox. So we've obviously created the Panda Sandbox because I'm working in it when I do my trainings. Please note that the logo is a little bit different in the sandbox. You see a little pile of sand, you see a little shovel. When you log into the live environment, it's just going to say Panda. It's just going to be black and white, and it's just going to say Panda. So please note that when you are, especially in the pre-go live process, if you're like maybe going back and forth or you're kind of checking out the sandbox to see how it's going to work, and then you're entering current client data into the live environment, just double check to make sure you're in the correct environment. You don't want to waste time entering live client data into the sandbox, because let me tell you, that's already happened. And you definitely don't want to enter in any test data or be playing around in the live environment, which has already happened. So please be aware. That's why we added some of this little graphic information on here so that you guys can tell pretty easily which environment is which. There's a link to the sandbox in your training manual. You'll still use your SQL email and password to get in, and your security will be exactly the same in the sandbox as it is in the live system. Little reminder for the attendance and quiz. I'm going to show you guys the quiz. Here it is. Let me go back one screen. So it's certified.sqlpanda.com. When you guys start entering live client data, the website is sqlpanda.com. It's pretty straightforward, really easy. If you guys are into, I love adding favorites to my internet tab. You can see I have all my most critical items across the top here. Do that for Panda. It's going to save you a ton of time. It's going to save you time searching. Every time I do training, I just come in and I just click my sandbox link, and it takes me exactly where I want to go. With regards to the Panda quiz, you'll come in here, you'll select admissions and billing. You'll enter in your name. You'll select your location from this drop-down. This is all SQL programs. And then there are 7 questions for the admissions team. So answer your 7 questions, hit submit, then that quiz goes to Marianne. She'll review that quiz, and once she has the quiz and the training roster, she will get you access to the live environment. All right, well, that is all I have for Panda admissions training. Thank you so much.